For hypertensive crisis, we have established that a BP greater than 180 for systolic and then 110 to 120 millimeters of mercury diastolic is considered hypertensive crisis. But I'm sure you've heard of the term hypertensive urgency and hypertensive emergency. And it can be very confusing for a lot of people. Is it urgency? Is it emergency? What are we dealing with? Okay, it's very simple. Don't stress at all. You say that the patient has hypertensive urgency. Okay, when the patient has this value for the BP, okay, but then there are no signs of end organ damage, so no symptoms. Patient comes to you, is walking, is smiling, okay, giving you some nice, killer walk, killer moves, nothing. You check the BP and you are getting very high values, all right, that patient is in hypertensive crisis and it's an urgent situation because the patient may progress to having end organ damage. But we are in a lucky window where the patient doesn't have end organ damage as yet. So that is why it's called hypertensive urgency. There are no signs of end organ damage. Okay, so that's the meaning. So just a high BP, then you are having hypertensive urgency. Remember, this is what the value is. Okay. Now, what's the second bit about hypertensive crisis? We deal with hypertensive emergency a lot in the emergency room. Okay. Hypertensive emergency is when you have a BP greater than 180, 110 to 120 millimeters of mercury, right? With signs of end organ damage. Okay, that means that you visibly get symptoms or signs that show that there is an end organ damage. So the way to go about it systematically is to start from head to toe. So from the head, you have CNS, right? So strokes, the patient may be having signs and symptoms of stroke, maybe facial deviation, lower limb weakness, etc. Okay, there may be retinopathy, so from head down. Then you go to the heart, they may have MIs, aortic dissection, so they'll come with chest pain, okay, renal, then you go down again, kidney, okay, so they may be having AKI, maybe they'll have signs and symptoms of all of these, okay, from top to bottom. So that's how you approach it. Okay. You look at the organs from head to toe, then you'll be able to pick up the signs of end organ damage. So that's hypertensive emergency, where the BP is this, okay, but we have signs of end organ damage. However, for urgency, there are no signs of end organ damage.